All right. Hello, and everyone. Welcome everyone to the Friday update with Mendocino County Public Health. My name is Cameron Brown, and today we're very happy to have our County Health Officer, Dr. Andy Coren, with us. And we're also joined by a number of local media outlets, so very happy to see them as well. For today's schedule, we'll get the latest updates from COVID and beyond, Dr. Coren. Then we'll jump into our question and answer session with the local news media. And then we'll also hopefully get some questions from the public on the YouTube and Facebook live streams that we can also get into Dr. Coren. So let's just get started right now. Dr. Coren, I'll hand things over to you.
Thank you. So today we're going to address four issues: the usual COVID update, Medi-Cal expansion. We're going to also briefly touch on the infant formula shortages that have affected our nation, and Mendocino County Health Department changes. So we'll start off with COVID. COVID in California, led by the Bay Area, is experiencing a new wave of confirmed COVID, rising case rates, and increasing hospitalizations as well. The state forecasts a peak in mid-June, and Mendocino County will probably follow the state by a few weeks. This is being driven by Omicron subvariants. In California, it's BA2, and the more highly transmissible BA2.12.1 is following up and increasing in its numbers. In Mendocino County, the daily new cases more than tripled over the past month. It went from 3.6 per 100,000 per day to now it's 13 per 100,000 per day. And according to the CDC, this is orange, or the substantial transmission level, but we will probably qualify as red, or a high transmission level, next week. Our testing positivity is up all over, and this is confirmed in other areas by wastewater testing, which is important because so much more testing is being done through home tests. The schools did show some increased antigen positive tests. Over 100 were reported in Fort Bragg after a spring break prom and party at the end of April. However, these numbers decreased rapidly, and the inland proms are pending, and graduations are coming up. These are all planned to be outdoors. Just to give a little perspective, that 100 positive cases back in late April compares to last year when we had our winter peak of antigen tests through the school of 1,700. We do currently in the county have 5 outbreaks. And these are not large outbreaks, but they're being closely watched, and follow-up testing is being done. Note that the unvaccinated are affected and become cases at a rate 5.6 times more than vaccinated. Hospitalizations in the same amount of time, or no, in less time, over the last week have doubled, with four Mendocino County residents hospitalized. This week, the bed availability, however, is not stressed. Remember, the unvaxxed people are hospitalized at a rate that is 8.9 times the rate of people who've been vaccinated. Nationally, hospitalizations have also increased 20% week over week, based on report in Johns Hopkins on May 12th. The deaths in Mendocino County have really not changed. They remain at 124. And that's a late indicator. So if the numbers of cases and hospitalizations increase substantially, we might have some increased mortality in another few weeks. Testing is continuing at the Optum Serve sites, and now with antigen tests as well as PCR tests. Also, there are free over-the-counter home tests available throughout many community-based organizations in the county, as well as schools and health departments. Treatments are now available. Oral treatments are for higher risk people who test positive and have some symptoms, and we want them to be started on day 5 or before. There are no shortages, so you must start within 5 days and have that prescribed by a provider. The test to treat sites where you can get tested and treated at the same visit are beginning to be available in Mendocino County. OptumServe testing sites and traveling teams are now test to treat sites able to dispense the treatment for those who qualify after a telemed call to a provider. At the Ukiah Fairgrounds, this is subject to nursing availability, which OptumServe is working on correcting. Our FQHC and rural clinics are applying for waivers at the state level. Mendocino Coast Medical Center on the South Coast, Medical Services on the South Coast has already been granted a waiver and is able to offer the service of testing and at the same visit a prescription. For severely immune compromised people, there is a new treatment that has been around that is for pre-exposure antiviral protection, and it lasts about 6 months. The name of this is Evusheld, and people will need to speak to their providers to see if they qualify, but it is very worthwhile if they do. Let's go back with this slide here that shows case rates. You can see the epi curve. Each light green line is the number of cases reported that day. And if we go back to the blueprint, well, let's first look at the peak at this point, which is not the peak, but where we are now is really not nearly as high as it was in February. And that was actually after the Omicron surge was beginning to taper down. But if you look at the colored lines below, they show where the cutoffs were for the orange, red, and purple cutoffs during while we were using the blueprint. So we're significantly higher than those numbers at this point. And but nobody is calling this a surge because the rate of rise of these cases is smaller. We have a much more vaccinated community, but we still see that these numbers are increasing at this point. Next is regarding the vaccines. So in Mendocino County, as of May 16th, our vaccination rates have slowed, but gradually are increasing in April and May. The Department of Public Health is also continuing to have special vaccine events and visiting care homes to ensure that all who want a vaccine can get one. And of course, our traveling teams are still available for getting vaccinated. As of this week, 75% of eligible people were fully vaccinated. This does not include the federal vaccines that have gone through predominantly the Native American clinics. Unvaccinated people in our community represent 17% of our population. 57.5% of eligible people have been boosted here. COVID is continuing to mutate, and treatments are a little less effective, and there is immune escape, but this is not 100%. So there's a couple of misunderstandings that I've been hearing in the community. One is that COVID is over, and it is definitely not over. It is increasing again, and we don't know what lies up ahead with other variants, but it is not over, and the precautions that are recommended should be followed. The other is people misunderstand the term immune escape as though our vaccinations are not working and that there is no immunity. And that's not true either. Although there has been a decrease in the efficacy of the vaccines, they still are extremely effective against hospitalization, severe infections, and death. New research in 1221 involving 300 million people showed that for every 10% increase in vaccine rates, the COVID case rate decreased by 7% and mortality rate decreased by 8%. What is new in vaccines, I hope you've heard, is that for the 5 to 11-year-old group, boosters have just been approved on an emergency use authorization basis on May 17th. That happened with the FDA and the ACIP and CDC, and now CDPH have also approved it for those children over 5 years old. Let me just see something here. And that's after 5 months from their primary series. So they have to wait 5 months after the primary series. Second dose is given, and then they're eligible for the booster. The applications for emergency use authorization are also pending for Novavax for people over 18 years old. And this is going to be considered in June. People have asked, what is the usefulness of this? Well, there may be some people out there who are still concerned about the mRNA technology. And this Novavax is developed on a protein-based product that is similar to many, many other vaccines we're already using. So that may increase our vaccination rates in the community. Emergency use authorization for children 6 months to 5 years old for Moderna and Pfizer primary vaccines are being reviewed in June by VRBPAC and FDA. Also, just a note back that the primary series vaccines for children 5 to 11 years old have not been fully approved, so there are no school requirements expected until July 2023. There is research going on at this point for Omicron-specific vaccines and combination vaccines, but none at this point are being recommended. And this should not delay anyone from getting boosters if they are eligible. Next slide relates to some information that, oh no, this, yeah, let's go to this slide. Information, CDC has addressed misinformation by developing a social media platform for accurate vaccine information in Spanish. Download at on your website for applications. Download WeChat and then text Hola. And that's what this slide shows. And so you could raise questions and you'll get answers from the CDC. Current recommendations at this point, while we are we're in a substantial but becoming red very quickly transmission rate community. One, stay up to date with your vaccines and boosters. Secondly, universal indoor masking is still required by the state in hospitals, nursing homes, outpatient healthcare facilities, corrections, and congregate settings and shelters. Indoor masks universally are strongly recommended for all in public indoor settings, including schools, and high-risk individuals and families may want to also wear a higher grade mask. If you're gathering or hosting a gathering, keep them small, keep them outdoors, and if indoors, open windows and doors to improve ventilation. If you're going to a gathering, test and stay home if positive or if you have symptoms. And if high risk and you're positive, call your provider right away for a treatment that needs to start within 5 days of symptoms in order to be effective. There are no changes in Mendocino orders for isolation and quarantine. I want everybody to also note that the rates of influenza are increasing throughout the country. This is an unusual season for that to happen, but we've had a number of people turn out to be positive even here in Mendocino County. And you may still get a vaccine if they are available. And if you do get a vaccine, at this point, you would be eligible for the vaccine for 2022 that comes in the fall. There are also treatments for influenza. So if you're feeling an illness, influenza-like illness, go check it out because treatments are available. The next topic I want to cover is Medi-Cal. Though the federal program under HRSA has stopped, California Department of Health Care Services and Medi-Cal is still covering uninsured COVID-related tests or treatments with presumed eligibility through DHCS, and registration can occur through the clinics. Also, as of May 1st, 2022, adults over 50 years old can apply for full scope Medi-Cal regardless of information status. I'm going to quote from the California DHHS agency, quote, when you apply for government funded benefits, your information is only used to decide if you qualify. State laws protect the privacy of your information. And this expansion of Medi-Cal is similar to the expansion in January 2020 for young adults, when the expansion included those people 19 to 25 years old. To investigate your eligibility, there are some numbers on the screen right now to call social services. You can also apply for, find out about eligibility and apply for Medi-Cal on benefitscal.com or coveredca.com, or stop by your local social services offices, open Monday through Thursday from 7 a.m. to 5 p.m. So we'll move now to the issue of infant formula shortages. And I think we have another slide about that. There has been a national shortage, started with the closure of an Abbott facility in Michigan that produces various Abbott formulas, such as Similac and Similac PM, and some additional ones. The closure was due to contamination and infection in February, possibly associated with many infant illnesses and 2 deaths. Abbott is responsible for 43% of U.S. infant formula production. So this shortage was significant and was compounded by COVID-related supply chain issues, and has been especially problematic for families on WIC who have limitations on products they can purchase. Now, this is important, and you'll hear about it throughout the United States. And most states have binding contracts through WIC with Abbott. However, California's WIC is contracted with a binding exclusive contract with Mead Johnson, another formula producer, which has helped our situation. However, the demand for nationwide has potentially caused problems. So this is being addressed on a national and state level with programmatic changes. I'm not aware of any local shortages yet, but if they occur, here are some important messages. Number one, most important, don't dilute the formulas that you have. This can cause severe disease, including seizures, due to missing nutrients. Similarly, don't use homemade products for similar reasons. There can be severe nutrition deficiencies and electrolyte imbalances that cause disease. For infants less than 6 months, remember that breastfeeding is best, and if it's possible, to begin the breastfeeding, and that should go on for a full 6 months. WIC has support for breastfeeding if you call 1-855-855-6455. Other alternatives, if your infants are less than 6 months old, check with your obstetrician, pediatricians, labor and delivery for samples. Also, smaller stores may have some in stock. Just check that they're not expired. It's okay to switch to another brand if it's not a specialized formula. For example, EleCare is a prescribed formula. No store brand exists for EleCare. People on WIC will have difficulties here, but they should, consult WIC, and we'll find a way to supply that. But I think, again, that won't be an issue in California. And if people can, and they have the finances, they can also purchase some of these products online. Do not switch to a toddler formula unless the infant is a year old or close to a year old. For those older than 6 months, switching to an alternative, if again, not a specialty formula, is okay. The other thing is that you can use whole milk, but not goat or plant or nut-based milk, such as almond milk or coconut milk, which have insufficient protein and other nutrients. Soy milk is okay for a few days if the children are close to a year old. The FDA has approved some and is working on approving others that are imported from Europe, but have not yet been licensed in the United States, and the FDA is working on expediting that. So the last topic on the agenda that I wanted to talk about is changes to our public health department. I wanted to announce that we're in the process of rebuilding our Department of Public Health in Mendocino County, which has fallen to a half of the size it was 10 years ago. We're thankful for all the volunteer help from county disaster workers, and other people around the county during the COVID epidemic. The pandemic has taught us a lot about our role in addressing the health of our community as a whole. In spite of all of the cooperation of those county partners during the pandemic, we've seen huge disparities of health outcomes in certain disproportionately affected populations. This includes our whole rural community, as well as certain racial ethnic groups such as Hispanic, Native American, and Black communities, the homeless, disabled, elderly people, people in congregate settings, and others less fortunate who have suffered as a result of longstanding inequities in our society. So we talk about social determinants of health. We know that 60% of all health risk is dependent upon not genetics or medical issues, but social issues. And we call those social determinants of health. So you can see on this graph that the top left part of that circle, 50% relates to social economic factors as education, employment, community safety, and physical environment, air and water quality, and housing transit, whereas the bottom 50% are all things that are traditionally considered medical, but they also are social determinants of care because access to care may be a problem, quality of care may be a problem, diet and exercise, although they may be prescribed by clinicians, are behavior issues, and these are all non-medical per se. We need to address them on a public health basis. So housing, employment with a healthier standard of living, education, including language, nutrition, clean air and water in our environment, access to transportation, as well as safe recreation and social support in neighborhoods free from the stresses of discrimination, racism, and violence are these social determinants. So being healthy is not just the absence of disease, but a state of good mental and physical and emotional health. So what does that mean for our health department? We're going to continue and improve the traditional programs such as maternal, child, and adolescent health, WIC, California Children's Services for the disabled, CHDP exams for the health and disability prevention, community wellness, which deals mostly with tobacco, lead, and accessible and safe walking and biking routes, environmental health, emergency preparedness, which we have suffered wildfires, and they address some of those issues. Communicable diseases and immunizations, which we've seen come into action for COVID, and also they work on childhood vaccinations. As we build back the Department of Public Health, we're developing also a new data group, collaborating with organizations like NCO and Healthy Mendocino to focus our efforts on activities most important for Mendocino. So much of helping people is accurate and timely information. So we're also developing a very strong communications team to work continuously with our community through social media and other modalities. And a key to understanding and effective communication relies on developing trust within all of our various communities here in Mendocino County. For example, the lack of trust in government and medical care has been reflected in the fear of vaccines. County government has already begun to implement changes recommended by our Diversity, Equity, and Inclusion group by translating all of our literature and websites and social media to Spanish. We also funded Promotores with $500,000 and to Nuestra Alianza and to UVA with $150,000 to develop some community health workers, and we meet regularly with and support our Native American populations. We have also community health workers who visit homes to support special needs of dozens of families. And now we want to expand our workforce of diverse community health workers who live in Mendocino County to expand those connections. We'll also be getting back on track to get our department fully accredited to assure our county quality for public health work. This was derailed by the pandemic. Few other California public health departments have this accreditation, but I think it's important for us to build our department back with that. We also understand how climate change is affecting us through fire and drought that's changing our crops, our forests, our fisheries, available food, and safe places to live. We need to address this through new initiatives to support each other and achieve resilience together. Environmental health will be a new focus with an equity focus, since it will affect our different people differently. For the first time in many years, this is just an example of some of the effect of climate change on our fisheries and the problems at Pudding Creek. You've probably read about the problems with bacteria and oysters, but the problems are significantly more than that. To support this, for the first time in many years, Public Health now has a director, Ann Mulgard, who will give us leadership to a new public health. In summary, we have many challenges ahead. COVID is not over. We must learn to live with it. It's changing, and it's changing effects. As our community goes forward, we're shaping public health to effectively address the challenges of the new normal, not just with a focus on disease, but on our environment and our community. And with that, I'll end and I'll be around for questions.
All right, thank you, Dr. Coren. So we have about a half hour for a question and answer session. So we'll jump right into that. For the structure, we'll go in rounds. So we'll give each outlet one question and a follow-up if needed to clarify. And so we'll go one question. We have 4 reporters, so it'll be kind of 4 questions per round, I suppose. And hopefully we can get through 2 or 3 rounds of questions and also incorporate something from the public as well, from Facebook and YouTube. So let's begin with KZYX.
Hi, thanks for having this. I was wondering, with the expectation that we're going to go back into the red zone, which we're all hoping was a thing in the past. I'm wondering if you anticipate issuing a new health order about masks or social distancing, or kind of reinstating some of the behaviors that we got so used to a few months ago.
Sarah, that's a great question. And we're talking about that at the state level, and I just got off a call with the clinics. Orders is not where we'd like to go. We are getting into the red and zone from a CDC perspective, significantly higher than we were in purple. But a lot of things have changed since we had all those orders. One is the community has learned to protect itself and the importance of masks, getting vaccinations and boosters. And I think what we want to do is we want to expand the messaging. What I heard this morning, was that many people are thinking, oh, well, COVID is over. And, we need to emphasize to people that COVID is not over. It's taken a different shape now. We're rising in numbers, and we haven't yet seen the mortality rate, but it may come. It's not the same as the Omicron surge, where the numbers just doubled on almost a day or every other day basis. But this is happening now. And as COVID continues, the risk for other variants that may not only spread faster, which the ones we have now are doing, but they could also be more virulent, or they may escape immunity or our treatments more than they are now. At this point, though, the issue about orders is something that I've written to the and spoken with the state health department. None of us are interested in imposing orders when people know what to do. And when the resources of the state, the hospital system, is not at risk for closure, which was the case when the orders first came into being, because the population wasn't going to take it seriously. The emergencies rooms did become flooded, the hospitals became flooded and overwhelmed, and people who had any illness couldn't get care through the hospitals because they were overwhelmed. We think we've got a better understanding, and the community has a better understanding, and we need to see what happens with this COVID wave and with other variants that come along. So as far as new orders, it's not what we all wanted to do, not what we want to do now. And so we'll have to see what's necessary.
Thank you.
Thank you, KZYX. And let's move on to the Independent Coast Observer. Susan, if you're with us, you might be on mute. Oh, there we go. Sorry.
Hi,
Hi,
thank
Susan.
you, Cameron. Uh, Dr. Coren, you mentioned 5 outbreaks currently. Could you please elaborate on where those are and how many people are involved?
I'm not going to give a lot of specifics. They're all small. I think they're all under 5. Find that I didn't mention each of them. Outbreaks. Here we go. So there have been outbreaks at several nursing homes. Two of our homeless shelters, and one at Ukiah Animal Care, and one at a charter school.
Okay, and they're all under 5 people?
At this point, yes. It may change when I hear the reports this afternoon, but so far, they've been under 5. And they're all doing response testing. They're all appropriately separating where they have, for example, in the congregate care facilities, to red, yellow, and green zones, modifying and toughening up some of their visitation practices, and so on and so forth. I can say that it's not like it was 5 or 6 months ago, but we don't know what's up in the future. So it is another indicator that the rise in cases is very real.
Okay, well, thank you, Independent Coast Observer. Let's move on to Mendocino Voice.
Hi, thanks. So, given that we are, just to kind of circle back to the rise in cases, but also the fact that a lot of, event schedules have pretty fully restarted, and people, the school year's done, so people might be traveling. Are there just kind of things you recommend people keep in mind as they sort of resume their summer activities and, maybe are traveling to places that might have different kinds of caseloads or hospital capacity or anything like that?
Yeah, so the rise is actually happening nationwide. California, of all places, is probably lower, certainly, than all of the larger states. There are some smaller states that have a less case rate or less hospitalization rate. But the general recommendations, again, are to stay up to date with vaccines and boosters. For masking, it is still required by state law for the hospitals, nursing homes, outpatient healthcare, corrections, congregate care settings, shelters. So you have to mask in those areas. As far as travel restrictions and mandatory masking and travel, that was taken down by the federal government and the state government at the same time last month. But indoor masks are strongly recommended for all indoor public settings, including schools, and especially for high-risk individuals and families, and they may want to wear a higher grade mask. Also, the recommendations are, if you're hosting a gathering, keep it small and outdoors. And if you're going to a gathering, test. And if it's positive, of course, stay home and call your provider to see if you're eligible for treatment. And if you have new symptoms, test and stay home, the same kind of thing. If you're high risk, you can get these over-the-counter treatments. If you're traveling, if you're using public transportation, it's a good idea to test yourself, because you don't want to spread it around to a lot of other people. And when you come back, it's a good idea to test yourself when you return. And if there's any question, stay home a day and retest again, and use the protection that a mask gives you and the people you're around. Does that answer your question?
Yes, thanks.
Okay.
Okay,
There
thank you,
are
Mendocino.
Sorry, let me just follow up. There are some outdoor events that are planned, concerts and things like that, where people may not be able to maintain 6 foot of distance. And we've seen transmissions, even though it's outdoors. We recommend outdoors, but outdoors presumes that you can maintain some distance, and especially maintain some distance when you're eating. So if you're eating outdoors, you want to maintain the 6 foot of people who are not in your household.
All right, thanks, Dr. Coren. And then we'll end this round with Mendocino Action News.
Thank you for having this meeting. It's nice to get all the above updates. I just have a quick question. Is it true that, or can you confirm that some of the schools have gone back to a modified quarantine version, asking that students wear masks?
The schools are all strongly recommending masks. They determine whether they're going to do modified quarantine. In general, it is so modified quarantine is a quarantine at home, but for a shorter period of time. What they're generally doing is group contact investigation and tracing, which I think we've gone over in the past. But if somebody in the classroom, in the space, you're sharing space, has had an infection, of course, that person does isolate, but the others are quarantined while education goes on, and they can participate in after-school activities and so on. I think there may be situations where school principals or superintendents say, yes, let's go back to a stricter quarantine program. But the concern about that is that, it's come out more and more that the education that the children miss and their social interaction that they miss is very significant. And we're really encouraging keeping people in school and doing these in-school quarantines. Does that answer your question, Danelle?
It does. Thank you very much.
Okay.
Okay, so I'm not seeing any public questions yet on Facebook or YouTube, but we'll keep looking there. So we'll jump back into round 2 with our local media. So let's have KZYX again.
Thanks. You touched earlier on wastewater testing, and I'm wondering if there is wastewater testing going on in the county, or if there are plans to do that to try to get a sense of how widespread the COVID is in various communities.
Good question. So we don't have any wastewater surveillance going on yet in Mendocino County. It can be a very expensive proposal to do that. We've worked with, and we're working with CDPH to get some grants for the testing apparatus, and also, more importantly, the expense of actually running the analysis 3 times a week. But I think there's a grant available that that's being worked on in the county.
Is there any sense of a timeline for when we would know if that was going to happen?
I don't have a timeline, Sarah.
Thank you.
All right, thank you, KZYX. And let's have Independent Coast Observer again.
Hi, thank you. I know Point Arena schools are planning indoor graduations and indoor events. They're having dances and so on. And I wondered, is there any plan to attempt to get them to reconsider that idea to do their graduation outdoors, or to at least wear masks or anything like that? Or is that just up to the individual school?
It's up to the schools and the superintendent in that area.
Okay.
It's not something that public health is mandating at this point.
Okay. Thank you.
Thank you, Independent Coast Observer. And let's have Mendocino Voice. Oh, Looks like actually Kate signed off. So we'll go to Mendocino Action News.
My internet is unstable, so I'm going to pass. Thank you.
Okay, let me just see Facebook. Okay, so we'll go back to KZYX if you have any further questions.
Well, you mentioned that there's an outbreak at Ukiah Animal Care. Is that the county-run animal shelter in Ukiah, or is that a veterinary center?
No, it's the county services.
Thank you.
Okay, and Independent Coast Observer, if you have any more questions, please go ahead.
In terms of budget, I know the supervisors are working on the budget in coming weeks. And I just wondered if the public health department is planning to request extra funding for COVID related issues, or that's something that mainly would be coming from the state and federal authorities.
I don't think we have any special new requests for public health for addressing COVID, because I think that the state and the federal grants have helped so far. But I wonder if, is Ann Mulgard on at this point? I don't see her. Yeah, so I can't answer that question really thoroughly. So I'll just leave it at what I said.
Okay, thank you. Can I ask one more question?
Sure, it's okay with me.
Yes, go ahead.
Okay, so some time ago, Mendocino County made a decision to stop providing any details about victims who are dying of COVID. And I wondered why that is. Sonoma County continues to supply very rudimentary details such as age, vaccination status, and whether the person was hospitalized or not, and also whether they have an underlying health condition. And it seems like an educational tool for the public. So I was sorry to see Mendocino County stop that. And I wondered why.
It's a good question, Susan. And the main reason is concerns about privacy. We have a smaller county, and if we say, such and such a person of this age, passed away from this area, everybody around them will know who it is. And, and so we've tried to keep the privacy of these individuals and their families intact by not putting that information out. We do address it statistically, and we are analyzing it to see if there are significant changes. But the main reason has been privacy.
Thank you.
Thank you, Independent Coast Observer. And let me get a couple questions in from Facebook. One wondering about the need for a second booster shot, and who should get that and why?
Okay. So it's a good question. Certainly those people who are the more vulnerable because they are elderly, over 65, should get a second booster. Those who are 50 and above, if they have underlying conditions, they should get a booster. They may get a booster if they don't have any known underlying conditions that increase their risk for severe disease. Those people, even who are down to 18 years old, if they have severe underlying conditions that make them more immune compromised, they're also eligible for boosters. For boosters. The second boosters are for the 50 and above, and of course they're eligible for the first boosters as well. But the boosters for immune compromised are present for anyone who is over 18 years old. And that goes for second boosters as well, if they're immune compromised.
Thanks, Dr. Coren. And then one more question wondering, is it safe to fly right now? And do you have any brief travel recommendations?
Traveling out of country, it's always worthwhile to check the CDC. There are places in the world that have a whole lot more COVID going on than we do. The airlines have claimed that there's less risk on the airlines. And I have seen many people in the airlines. I was traveling last weekend to a conference, and many people are taking off their masks, but it is strongly recommended. On airlines, it's a closed space, and certainly in buses and taxis and so on, where you're sharing them, wearing a mask is highly, highly recommended. The issue with airlines is that they have a closed but very active air system that they claim is really filtering and cutting down the viral particles if they're there, and gives less risk to people. But my advice is to wear a mask, and even more so in places like buses and taxis and so on and so forth, trains, because they don't have the same sort of air circulation that airplanes do. And then I mentioned with another question that if you are traveling and you're getting on an airplane, you may be required to have a test before. And when you get off, it's worthwhile to be tested at home. You can test at home or go to one of our Optum sites. Many people, if they're out of state, it's still a recommendation to quarantine yourself. And I would suggest get tested at that point, quarantine for maybe a day, and then retest again a day later. And you'll be pretty sure to protect those people around you, including your family.
Thanks, Dr. Coren. I think we have time for one more round of questions from reporters. So KZYX, if you have any questions, please go ahead.
I think that does it. Thank you.
Okay. And then Susan with Independent Coast Observer, same for you. Any more questions?
Yes.
All you.
Thank you. I have a question about, and I cannot pronounce this word, the drug. I believe it's Paxlovid.
Yes, you did great.
Thank you. I read that people are taking this drug and then reconnecting with the illness, getting ill, getting COVID again after finishing the drug. And I wondered if you had any personal experience with that in Mendocino County.
No, we haven't had I have not heard of any case in Mendocino County. It was brought up at a state meeting on last Wednesday. And as you know, COVID can kind of hide out and be latent. And also there's breakthrough from any medicine or any kind of protection. So there's some hypothesis that it knocks it down. In most cases, the immune system, once the numbers of viruses are beaten back by Paxlovid, the immune system in most cases finishes them off. But in some cases, it may bounce back after another few days. And so those are theories. We don't know. It has been something that has been talked about, and it's being actively researched.
Okay, thank you.
I should say though, Susan, because a lot of times these answers are misunderstood. Paxlovid is extremely effective, just like vaccines are extremely effective. There may be breakthroughs. Nothing's perfect, but this is one of the things that's definitely being researched.
Thank you.
Okay, Dr. Coren, I think it's time for your closing comments or any final recommendations you might have.
Well, what I'll say, I'm not going to give specific recommendations. That would make it 3 times and really bore everybody. But I will say that we are in a new phase of COVID. This is trying to get us to be a new normal so it doesn't dominate our lives, so we don't close down industry. so we don't overflow our hospitals and we maintain and grow a quality healthcare system in our county and in our state and so on and so forth. But we have to understand COVID where it's at right now. And while the variants that are going through our community may not have yet caused significant increase in hospitalizations and deaths, they have caused increase in hospitalizations and in COVID, and we don't want it to grow out of proportion. Remember that COVID is just about a year and a half old. The information that we get is old, and we don't know what this variant may produce or what will happen as it becomes more complex, where we had in the past surges when there was no vaccine around, or we're just breaking vaccines out. We now have a wave with the majority of people in the population are vaccinated, but it's also happening at a time where there's some escape from the vaccine immunity by the variants, and there's also some waning of the immunity, just because that's how these vaccines, that's how they fly, and we're learning about that as as time goes on. So we do want people to be cautious. We've made adjustments in how we address the public rather than making orders that in some cases are scoffed upon and feel like they're imposing on people's liberties. We want strong recommendations, but we want people to understand that those are real recommendations. And even though you may, or a person may be less at risk, they may pass an infection on before it's even symptomatic to someone who is vulnerable and cause them severe disease, hospitalization, or death. So this is the new normal. We want it to be not an emergency, but we do need the cooperation of the entire population to address it correctly. And a big part of that is wearing masks indoors, in public areas, and getting vaccinated and boosted. So keep those things in mind. And if you're sick or you test positive for one reason or another, contact your provider and think of potentially getting Paxlovid or Molnupiravir, one of the new treatments that are very effective, and they're no longer scarce. There are some restrictions on who it's appropriate for, but you need to check with your provider. Or alternatively, if you get tested at one of the Optum sites or one of the clinics, as they become test to treat sites, you get treated right on the spot. And these are pills. They're easy to take. They're just like if you had a strep throat. We want to move into a situation where hopefully we'll have COVID under that same control, and it won't be so threatening to our society. That's all I'll say.
Great. Thank you, Dr. Coren. And thanks to everyone that listened in today and asked questions, including our local media. So going forward, we're going to have media days every third Friday of the month. So that means in June, that'll be June 17th on Friday at 2 p.m. So we'll look forward to seeing you all there, and hope you have a great weekend. Thank you.
Thank you.